Welcome to Geological Shop Talk. In this podcast, we bring you roughly 20 to 25 minutes of practical clinical methods, perspectives, and advice that has its work boots on. Listen in for clinical gems that you can begin to investigate the next time that you walk into clinic. Additionally, visit the show notes page for supporting materials from this week's guest on Shop Talk. All right, friends, roll up your sleeves. Let's get to work. This episode of Shop Talk is brought to you by LASA OMS, your clinic's partner in wellness. Later in the show, listen for a special offer from LASA to help you with all the transitions your patients face. The information shared on this podcast is for educational purposes only and is not intended as medical advice. Always consult a qualified licensed healthcare professional before making any decisions about your health or treatment. The host and guests are not responsible for any actions taken based on the content of this podcast.
Hi there. I'm Lisa Lapwing, and I'm super excited to be back on Shop Talk. In today's edition, I'm offering you pertinent questions I ask my male patients outside of our traditional 16. These questions are specific to the male physique and will provide you with valuable information to help you better understand what their body is doing so that you can make a clear differential diagnosis and appropriate treatment plan. These questions become important to ask when assessing patients who have come to you with conditions such as erectile dysfunction, premature ejaculation, BPH, prostatitis, or other andrological related issues. So you still want to be sure you take a clear history and background from these patients, asking them the traditional 16 questions. And we're going to use those in addition to these questions to create a well-rounded, comprehensive understanding of what these patients have going on. Before we jump into these questions, you need to understand that you have to be comfortable using specific terminology related to the male physique. If you're not quite comfortable using words such as penis, ejaculate, erections, prostate, intercourse, I highly recommend you practice with someone you are comfortable with. It can be hard at first to use some of this terminology, but the more you use it and the more you maintain your professionalism while you use these words, the easier it will become to ask these questions with confidence and poise. That will reassure your patient that you're professional and make them feel really good, comfortable, and confident with you. This is a sensitive subject. We really want to create some strong rapport with our patients. So let's dive into these questions. Important questions are, how often do you get erections? How often do you get morning or overnight erections? What is the quality of your erections? You can give them options on a percentage scale. Is it 30% of what it used to be, 50, 90? What is the quality of their erections? Are you able to have an erection to completion? That is, are your patients able to maintain an erection through to orgasm and ejaculation? Is there a difference in your erections between penis and vagina sex, oral sex, or masturbation? This question can give you a lot of information about their hormonal cascade based on what stimulates them. One of my other questions I always ask is, do you have pain with erections? I personally see a lot of patients for chronic pelvic, penis, perineum, and testicle pain. So it's a very important question to ask if you're seeing someone with any of these conditions. So, of course, then I also ask if they have pain in the perineum, in the testicles, or in the scrotum, in the pelvis. Patients don't always understand the pelvis. That could be the pelvic bowl, it could be the hips, It could be the perineum. It could be more towards the abdomen. It could be more towards the back. So if they aren't quite clear, you can help by spelling it out for them that this is where the pain could manifest in these areas of the lower body. Another really important question to ask is, have they been given a diagnosis? Often, patients who are coming to you for these conditions have already seen a urologist, and it can be really helpful to know what diagnosis they were given, if they were given one. And if not, I do suggest at some point they do see a specialist, because a specific diagnosis can help you hone your treatment later on. Also ask your patients if they know what level their testosterone or PSA are at. And the answers to these questions become important if you're treating such conditions like BPH or prostate cancer. If you have a patient who has prostate cancer in their family history, PSA is something I suggest you recommend to them they keep an eye on. Another important question is, what is the color, smell, or consistency of the ejaculate? The answer to this question can tell us if there's possible prostatitis infection there. Another important question is, has any of the above changed recently? Has it always been out of the normal, or have you noticed recent shifts, pain that wasn't there before, discoloration that wasn't there before? You were getting nighttime erections, but now you're not. So you kind of want to jump back in with them and ask if any of these changes have happened in the last few weeks to the last 3 months. Look for patterns there. I also ask about discoloration, bumps, tender spots on the penis, testicles, or perineum. This again can lead us to possible diagnoses as far as varicocele, which is a varicose vein in the testicle, possible prostate cancer. So it's a really important question to include in your interview. You also want to know how many times a week does your patient ejaculate. If it's excessive or if they're ejaculate withholding, that's going to also give us a clearer picture to what's happening on a deeper level of the body. You want to ask them if they have had prostate stimulation or massage recently. Could that be the cause of something, pain or a change in sensation around that area? You also want to be sure to ask them if they have pain during or post orgasm. You want to ask if they have sustained injury to the genitals, to their spine, or to their hips. You think that this would be an obvious question that patients would answer, but believe it or not, patients are not always going to associate a back injury to dysfunction of their genitals. So it's up to us to do our investigative duties and find out if this could be contributing to their issue. This is a difficult question to ask, and you may not want to ask it in your first interview with your patient. It may come along a little bit later. They may also check a box in your paperwork about it rather than openly give you this information. At some point, if the information isn't readily given to you, I think it's very important to ask your patients if they have a history of sexual abuse. Now, you don't need to go into detail about them with that. If they offer it, okay, great. But unless therapy is in your scope of practice, just even knowing that they have a history of sexual abuse can help me formulate a diagnosis and treatment plan without knowing some of the upsetting details. Now, if they offer that up to you, okay, I want to say great, even though this isn't a subject we want the word great surrounding, but the details can, again, give you information on some of the psychological effects that they're dealing with that could be affecting their body. And just remember to remain compassionate, open, and empathetic. It's a hard subject to approach. And I will tell you, I have seen a large male population who has had sexual abuse in their past, and that is why they have come to me with various things like ED, premature ejaculation, pain in the penis and pelvis, and so forth. So it's out there. So if you choose to treat these things, chances are you're going to see it. One of my final questions I ask is, do you engage in sexual activity outside of what we would consider normal penis and vagina, oral sex, or masturbation? So this could be anal sex. This could be things where patients are using some sort of BDSM. So there could be a little bit more aggressive treatment of their bodies during sexual encounters. So that too will give you some information on how to treat their bodies. Again, it can be hard to approach patients with some of these questions at first, but you can always talk to yourself in a mirror, ask, a peer, a counterpart, another acupuncturist to get comfortable and really take a thorough look at the answers to these questions, as well as your basic questions you're going to ask them. I want to make note that also means it's really important to ask about their urinary habits, their bowel movements, because those things as well are going to affect the genital region. I've seen if patients have constipation, chronic, it can show up as pelvic pain or pain in the penis or testicles. And they haven't mentioned that because they don't make the association. So I'm struggling, like, why can't we nail this down? And then out of the blue one day, they're like, oh, yeah, well, I have chronic constipation. It's like, oh, okay, I asked you about that. You said no, but here we are. So the point of that, too, is keep checking back in, especially if you're treating a patient for something like ED. You want to continuously ask how often they're getting erections. Have those erections that maybe were missing overnight started showing back up again? What is the quality? Have we gone from 30%? Are we creeping up? Are we now at 40, 50% quality of erections through our treatment and or herbal program? So just like our other questions, we put everything together. We get this big holistic scope. We keep asking these questions, right? So we can properly track our patients' progress. And hopefully they're getting better. So when they are able to report to you, yes, this is getting better, that's encouraging for patient and practitioner. So those are my important 20 questions when you pull them apart to include into your patient intake interview when you're first seeing patients for common male andrological issues. Some of them I mentioned you may not want to spring on your patients that first appointment, but work them in as you get to know your patient better. For more in-depth understanding on common men's health conditions, you can take one of my courses. I will have information on my upcoming courses on my blog at whole-healthacupuncture.com/blog. Currently, I have the date of 10/7/23, Saturday the 7th of October, set for my course BPH and how to successfully treat it using TCM principles. The fantastic Florida State Oriental Medical Association will be hosting me. And as soon as I have the link to that class, I will put it up on my blog so you can sign up for it. Or you can contact me directly. I also offer consultation services, and I'm always here to just talk to other practitioners about this subject. I'm super passionate about it. You may have heard my geological episode with Michael Max talking BPH. I don't think there's enough education out there about it. I'm working to change that. So you guys can reach out to me anytime. I thank Michael Max for allowing me to be here, do my thing again, and I thank you all for listening and being a fantastic practitioners of our beautiful medicine and art.
When you're looking for herbs, tools, and supplies to guide your patients through life's transitions, you need quality you can trust. Lhasa OMS offers an unmatched selection of acupuncture needles for every style, herbs from all your favorite manufacturers, and everything else you need to run your clinic with confidence. Visit LhasaOMS.com to source the herbs and other supplies featured in this series. Use the code FERTILE15 for 15% off your next purchase at LhasaOMS.com. Some exclusions apply. See website for details. That's it for this episode of Shop Talk. Did you learn something that brought a patient to mind? Don't keep a good thing to yourself. Share it with a friend. They'll be happy that you did. And tune in again for our next episode of Shop Talk.